Good day, I'm student Miss Young, and today we'll be administering an IM medication, meaning an intramuscular medication. So, first thing first, we get our patient's file, as well as their drug chart. So in this institution, they don't really need to go in the doctor's notes because the doctors are the ones that do up the drug chart and their signatures attached. In it, we'll have the name of the drug, the dose, the route, the frequency, the date it was started, as well as a log of when the nurses would have given medication last. So they put the time, the date, and they would sign off, right? So let's get to know our patient. Our patient is her biographic data, Mrs. Martha Kent. She's 67 years old, female. Date of birth, the 5th of the 1st, 1955. Nil known allergies. Diagnosis, soft tissue injury, acute confusion secondary to dehydration, and osteoporosis. Her present complaint of pain 8 out of 10 on a pain scale of 0 to 10 in the left ankle after ambulating out of bed without assistance. Doctor's note. So the prescribed drug is Patidine 15 mg IM, frequency every 6 hours or as needed, which is PRN, which means as needed. Right? It's to be served according to the doctor's notes with Gravol 25 mg IM. And looking at her drug chart, her last dose was on the 25th at 4 a.m. So we check it back, that'd be 28 hours ago, and today's 26. So she can get her medication, right? However, with this drug on this particular ward, the drug Patidine comes in 100 mg in 2 ml, and Gravol comes in 50 ml, meaning 1 ml. So we'd have some calculations to do. So when you're calculating the drug, you put the desired amount over the amount on hand, the dose on hand, multiplied by the quantity. In this type of calculations, the volume available on hand is the quantity, right? So we want what was prescribed for her for the Patidine is 50 mg. So our desired dose, the 50 mg over what we have on hand, 100, multiplied by the quantity, which is 102 ml. So the 2 ml will be the quantity. When you calculate it, you'll have to say administer 1 ml. Right? And for the Gravol, 50 mg per ml, we want 25. So 25 will be the desired amount on top over the 50 multiplied by 1. And you'll get 0.5 ml Gravol. So Patidine is a DDA drug, and student nurses can't give it, so I have to go to a senior nurse to get that drug. The drug, any drugs coming out of the DDA has to come out in the presence of 2 nurses. The one taking it out have to sign, and the one that is the witness will have to co-sign. There's also a DDA book. You put the name of the drug you give, the amount. If the drug you're taking, in our case, how there will be a balance, and you're putting it back, you have to calculate and balance off the amount in the DDA cupboard. You'd also have to put the patient name, meaning the patient you will be administering it to, the date, right, and the time. And then that cupboard will have to be locked back, right? There are 2 doors to lock the cupboard. So, Nurse Nelson, I'm going to be senior nurse. I have a DDA drug to give this patient. I already did the calculations. This is the drug chart. This is the patient's information and doctor's notes. Right? And I know I'm a student nurse, so I can't take it out. So I came to you. So Nurse Nelson would have taken out everything, and in the presence of him, now and that the medication is out of the cupboard, I could proceed to prep the medication. But before that, the patient also has the right to refuse. So I want to go first, find out if the patient wants the drug, and if the patient says yes, then I would proceed to take out the medication. So you have to make sure it's the right patient, the right medication, the right dose, the right routes, and the right time. Right, so let's go talk to our patient, assess the patient. We will have check her notes, all her vitals and everything are good. We want to assess her knowledge, if she knows anything about the drug she's going to be administered, the action of the drug, the contraindications. You'd want to know if she knows any of the side effects, adverse reactions, if she have any allergies or hypersensitivity or things like that. As well as with these types of drug, you want to know the patient weight. Because she damaged her ankle, they weren't able to get her weight. She's not supposed to be ambulating at this point in time, right? So you should look at their age, their weight, as well as their muscle mass, and from her information, she appears to be underweight, right? And very thin. So You use that information to gauge what type of needle you'll be using, right? Your needle gauge. So, gauge. So let's go to Mrs. Kent. Good day. I'm student Miss Young. And you are? Could I see your ID band? Yes, you may. Okay, so I'm just putting it here. Could you tell me your name, first name, last name, and date of birth? Mrs. Martha Kent. The 5th of the 1st, 1955. Thank you very much, Mrs. Kent. So, I saw that your doctor would have prescribed Petadine and Gravol together. Do you know about these drugs and what they're given for? No. Okay. So Petadine is a synthetic opiate analgesic, so it's used to relieve pain, right? And some side effects of Petadine is nausea, vomiting, dizziness, headaches, and some more severe side effects or face reactions are respiratory depression, which meaning that you'll have problem breathing, as well as low blood pressure. Knowing all of this, do I have a consent to give you the medication? Yes, because you're having pain. Okay, Mrs. Kent, I'm going to get your medication prep and then I'll come and see you in a few. Alright. So Miss Nelson would have taken out everything. We'd have done a first check when we look in the DDA cupboard and took out this. Miss Nelson would have took it out, cosign, etc. So now, in the presence of him, I'm going to put up my medication. So hand hygiene, first thing first. Right, so I have my drawing up needle, my needle that I'm going to give the medication with my injection needle, and the 2 syringes, my gloves, dry cotton swabs, garlic blood, sharp spin, right, medication, and my Petadine, right? So let's start. Drawing of needle. I check the expiration and everything on the needles. Check the expiration, everything good. Same thing with my syringes, the packaging, everything is good. Right? Taking out the Gravol first because it's a multi-use vial. Putting it at eye level. 0.5, lovely. Put that back. Right, so I'm not recapping, I just rested there. Now I'm going to draw up my Petadine. Take out any drawing up. Place it open. I'm taking up the balance, right? So I don't want to cut myself by using a dry cotton swab. I check already, I did my check, I checked my expiration date already, I checked my expiration date. Everything was good with the Gravol, the date, the expiration date and the name of the drug. I check it back here. Right, before and after you're supposed to check up, break open this thing. Pull up the 1 ml, which should be the balance. Right. And I already have the stuff right up. That is Petadine 50 mg, the date and the time. Right, this going back in the DA cupboard. I'll give Miss Nelson, you put it away. Right? So I put up, I'm going to pull up now the remainder, which is mine in here. So I'll pull it up. I'll pull it in the 0.5 and the 1 would make it 1.5 in total. I have in here, right? 1 ml, I take it out. Right? Right, so I can dispose of this needle. Open. Right, this will be my injection needle here. So the patient will see Petadine I given them, attaching the vial to this here. Right? Right, so now we're going to go to Mrs. Nelson, right? Hi, Mrs. Kent, I'm back. So Miss Nelson is here with me and code for privacy. I do hand hygiene again. right? We're giving it on the deltoid because it's only 1.5, so anything that is 1 to 2 mLs max, we could give it to the patient on the deltoid. According to the CDC, there's no need to aspirate with this amount of drug and where at this injection site it's going at, due to the fact that it doesn't have any major blood vessels there, so we don't need to aspirate. So I would have a medication chart. My last check is on the bedside of the patient. This is scanned, yes, everything, petidine, the gravol, penicillin, everything good. So I'm going to check the deltoid process. You want to stiffen up your muscle when I'm giving you the medication, that's why it will hurt, right, Miss Scant? So you're looking at the acromion process. You're going 2 finger width away from it, this bone here, which should be about here. Right. So I have to get an alcohol wipe to map up my spot. I'll have to make all the parts. So my 2 finger width, and I said it would be from here. So you start in the inside, go out 5 centimeters. Medication, and cap, right? So I'm going to go in now. Remember to stiffen up. Go in 5 seconds. You pull back using your non-dominant hand before you go in. Is the track method. You're going in straight because it's a 90-degree angle. So you're going straight, quick, smooth. 5 seconds. You're pushing it in 4. 1, 2, 3, 4, 5. Leave it for 10 seconds to make sure it doesn't go back in the subcutaneous tissue. So we count 10 seconds. Pull out. Hold down. Right? Nice. So I'll come back in the next 15 to 30 minutes. Mrs. Scan to check on you, right? And you put it in the sharps. You want to go in and lie down position. Make sure the patient is comfortable. Lying down. Fix her back, right? Your document. Time, sign off, everything. Nice. Up this stuff, going back over here, clean up the area, the sharp skin there, exactly, cut this one, the dorsal hand hygiene, always hand hygiene, right? And in your nurse's notes, you're going to document that you give the patient the medication, petidine and gravol, the dosage, where you put it, the deltoid, which side. In this case, that's her right hand, right? You sign off on it. So I will have to come for Nurse Nelson to count the signs. You also count the signs on here as well. And I will dispose of the vial as well in the sharps container. Right, and I'll perform hand hygiene again. 15 to 30 minutes have gone. I'll go back by Mrs. Kent. Mrs. Kent came back to check on you and check this spot. So to have no swelling, redness or anything. Are you feeling any way? No. Could you remind me the purpose of the drug? The purpose is for pain, and the gravol is to counteract the side effects of nausea and vomiting that the petidine might cause. Nice, you remember, right? And everything is good with you, right? Thank you, Mrs. Scott. So that's basically how you give an IM medication. Thank you.